Welcome to OAC's monthly broadcast, our November episode. I'm Christy Kuna.
I'm James Zervios, and we are so excited to once again have all of you with us here today. It's
fall.
Feeling like fall.
It's feeling like fall. Fall is officially here. I think this episode is our November special fall as we gear into the holidays. I think we've been in holiday mode a little bit, but really excited for today. We're going to talk a lot about gratitude, giving, and
health insurance. We know that can be a difficult topic sometimes, and we have a really wonderful expert with us today to help with that.
Yes, this episode is all about kind of getting ready for this holiday season and showing that gratitude. So as you all are in the chat right now, which we see you are, share what you're grateful for coming up. I mean, gratitude is something I think a lot of this exercise that folks have really focused on. And so share with us in the chat what you're grateful for. We are going to get to that in just a little bit.
Yeah. It doesn't always have to be something super, I mean, you could be grateful for anything. You could be grateful for something simple too. So just let us know in the chat.
And we'll share ours, right?
Yes, we will.
I know one thing you're probably grateful for. I think we'll get to that though. But like we said, today's going to be a great episode. We have a special guest joining us in just a little while to talk us through health insurance, Jamie Fivecoat. So excited to have her.
Yeah, and then we're going to want to have everybody stay tuned until the end of the episode today, because we have another special guest with us. We're going to talk about
in the studio
some special announcement today as well for the Stop Weight Bias campaign. But before we get to all of that, let's go ahead and say hi to everybody who's watching today. We see we have Laura from Michigan. Laura, thank you tuning in. We know you're always with us here on the broadcast.
Loyal. We have Anna from Florida. Anna, we're in Florida too. That's where OAC's headquarters is. So happy to have you.
It looks like we also have Michelle from New York and then Shelly from California.
A couple of those folks in the mix.
Thank you guys for tuning in.
Yes, and so one thing that we talk about is we're grateful for everyone who is chatting. Keep that chat going because
as usual, that's how you have the opportunity to win some of the most amazing giveaways that we have. And in fact, today we'll be giving away 2 mugs for the Stop Weight Bias campaign. You'll notice here, I'm not sure if you can see, but it's actually a fall theme, and we're going to talk about that a little bit later, but we're looking forward to giving away 2 of those.
Yes, and we're going to talk about the fall line, where this comes from, so stay tuned for that. Great excitement going on. So keep those comments going. Again, share those gratitudes with us, because we're going to reflect a lot. We're going to talk about a lot of things in this episode, but we want to hear from you. So keep that going in the chat.
Yeah, to shift gears, Christy, so we're going to talk about OAC updates a little bit.
Let's do it.
One of the things that we are so excited to announce right now is that the OAC has launched the official OAC Resource Library. Christy, you and I have been with OAC since the beginning. We've seen it grow. We've seen the education grow, and it's something that people always come back to OAC for time and time again, whether it's the magazine, convention, health talks, which debuted this year, so much.
Yeah.
But it's not so easy to find sometimes.
I think what we discovered is we have so much great content and so many different ways we deliver content. So we thought, you know what, it is time that we consolidate it into one spot. So I am really, really excited about this debut. And I know you're going to walk us through just a sneak peek at that in just a second here. But the resource library is going to serve as a really great tool and resource for everyone to easily find information and to kind of consume it in the way that works best for you.
Absolutely. So what we did here at OAC, and this has been a project that's been about a year in the making, is we actually went through and looked at all of our content. And you can see on your screen right now, we have the resource library up, and this is now live. So if you go to the OAC's website, obesityaction.org, don't do it right now because there's still a lot of great stuff in the broadcast. But after the broadcast, you can see on the URL right on the bottom of your screen, obesityaction.org/library. You can check out the brand new OAC Resource Library. And I'm just going to show you guys how easy this is to do right now. So we have all of these topic areas that we know everybody wants to learn more about. Advocacy resources. Advocacy is a huge part of what we do. And we also feature our information in both English and Spanish. But to give you guys a little bit of a test drive here, if I come over here and I click on bariatric surgery, you're now going to see all of the articles that we have on bariatric surgery, and you can load more if you'd like, and they will continue to load. We have all of our brochures, which talk about bariatric surgery as well, fact sheets that talk about bariatric surgery, our guide to work with your insurance provider. This is actually, kind of timely because of our topic today. So we have our insurance guide is there as well. And then we have our videos in here that also will focus on that topic. So all of the content that you're seeing there has to do in some way, shape, or form with bariatric surgery. I even see we got a health talk video right here. We're going to have some more information on those just a little bit later.
Yeah.
But this is a great resource.
I love this. It's a one-stop shop for all your educational needs. And I think there at the top, I love the fact that you can even choose what method that you want: an article, do you want a video? It makes it really, really easy. And the filtering on this is fantastic. So as you can see, we cover, it also shows you all the different types of topics that we've covered throughout the years. I mean, this is 16 years worth of content there for you. And so definitely check this out. The areas that do have that padlock are those reserved for premium access membership. So those who have that membership add-on can access that through their login. So that's still there. So really excited about this great new resource for folks.
Yeah, and I do want to give a shout out also to Chris Gass on the OAC staff. Yeah. Chris was the manager of this project.
It's a labor of love.
For the past year, and he just done a phenomenal job putting it all together. Like I said, if you've been with the OAC for a while, and most of you watching today, I know your names by heart, and you have, go check this out, because the sheer amount of information that is in this library is just magnificent. And please help us get the word out about the library. Yeah. Please share it on social media. Please promote it in your newsletters, anything like that. This is just an absolute wealth of information for people to go and check out.
Easy link to share. It's a great arsenal. Great to back up any of those advocacy actions that you're doing. If you want that credible information, send them to that link you see on the screen. So lots more to come. We're going to add more content to that.
Yes.
And actually next year, we're already planning, our plans are underway to fill that library with even more current and relative content. So we're excited about that. And so speaking of that, educational, we'll keep on the educational front. We did host our November Health Talk just last week, I think it was, and it featured the topic bariatric surgery, everything that you need to know before and after surgery from a patient's perspective. It featured Crystal. And so, I mean, if you know and have seen Crystal speak, she's fantastic. Very well received. We live streamed that health talk, but don't worry if you missed it. It is in the library. James just showed you a sneak peek.
You know what's great, Christy, about those health talks, and I noticed this, I've tuned into all of them, but especially on this one and the one that Sarah did as well, is the chat on the side as well.
Yeah.
You see people asking great questions in there.
Yeah.
And you also, what I love that I see is the dialogue back and forth between people.
Those live stream events do allow for that to happen, so we hope you can take part in those. The next one coming up is our December Health Talk, and it is on the topic about how to enjoy the holidays and stay on track. Again, another very timely topic for our community. Dr. Nina Crowley is going to walk us through this. She's a registered dietitian as well as a health psychologist. So you won't want to miss this one to round out our educational series on this. December the 16th at 7 o'clock Eastern. You can view it live as well as take part in the chat like you were talking about. And so for all of this, we are really looking ahead, as mentioned, to our 2022 educational priorities and topics. So we just launched last week an open call for all the topics that you want to see us produce and address in the coming year. So with that, what you're going to want to do is follow the link that's on your screen. I know it's long, so right down underneath this player, you're going to see all the links to the episode. Go there and submit the topic that you want to see us address. We are in the midst of this planning, so we will consider all the submissions, and this is our way of letting you all, our viewers and members, be the ones to really dictate what our educational agenda looks like. So we really appreciate that. And also on that page, if you are interested, and if you're a health professional or someone who's interested in speaking in our 2022 convention, which will take place, details to come, that is where you're going to submit your interest in speaking for next year's educational program for convention. So lots to unpack there with our education that's happening right now.
You know, I think coming off of the coattails of that, Christy, is that not only are we asking folks for educational topics, right, which really helps us kind of understand the things that you all want to learn about, what you want more information on. We also have the member survey, which comes out tomorrow. And sometimes I don't know if people, I think you get surveys, everybody's into surveying these days, but I don't think sometimes everyone understands why we do this annual membership survey, just how important it is, and how does it help us shape the priorities for the coming year and beyond. We've
been doing this survey for a number of years now, and we take every bit of feedback to heart. So much of this is just you all being able to drive the types of programming and the issues we face that we want to tackle in 2022 and beyond. So for those of you who are members, you're going to get this link to the survey tomorrow. So check your inboxes tomorrow. The survey will be out. We really appreciate your feedback. We value your feedback, so definitely stay tuned to that. And we do have a little incentive because we want to make sure folks know their time is honored. But if you respond to the survey by December 17th, you're going to be entered into a giveaway for one of 3 Amazon gift cards. So it's a pretty good prize, ready for good for holiday cash coming up.
Holiday shopping.
We'll help you with that. So so stay tuned to that. We really, really appreciate your feedback.
Yeah, and so last but not least, we were so excited to unveil the brand new Stop Weight Bias merchandise. This is, Christy, this is a limited time.
What?
This is fall merchandise here.
A fall line?
We have fall-themed Stop Weight Bias water bottles. I have this one here.
It says this one's a little different too.
The time is always right to do what is right. Hashtag Stop Weight Bias.
Together we make change, and this follows some of the other thematic components too. And
we also have, because it's fall.
It is fall.
And it's getting cold.
Chillier.
I actually see in the news that next week we could have a pretty big storm in the Northeast. In the Northeast, it's going to be super cold up there. And if you find yourself in 20-degree weather, there's nothing more you need than the official Stop Weight Bias long sleeve shirt. It's not backed by science, but this will keep you warm up to 10 degrees.
Well, I would challenge those who live in the Northeast to submit your comments about that. Here in Florida, our chill is a little bit different, but that's okay.
Well, either way.
But yeah, what's great about this merchandise I want to add is that not only is it a great tool to kind of spread this powerful message about Stop Weight Bias, and it is supporting this campaign, and all the proceeds from this merchandise directly support OAC's weight bias efforts. Plus, you can also make an additional contribution, tax-deductible donation, when you purchase these items. And I know they're a limited time for the fall line.
So you know, what's interesting, so OAC, I think we've jumped into the merchandise arena here and there, but I have to say, in all sincerity, the Stop Weight Bias merchandise is one of the most successful merchandise lines that we've had. This stuff honestly is selling constantly, and these items are only available for a limited time till November 30th. And you can get these by going to stopweightbias.com/shop. You can see it on the bottom of your screen right here. We can even see some of the items that we have available right there. So after the broadcast, go to the website, check out the new merchandise, and maybe see if there's something you like.
Yeah, absolutely. So very exciting. And again, stay tuned to the end of this because we have one other item that we did not present here that will be available with a special guest here in the studio.
Special guest will be modeling this item. So
you won't want to miss it.
Stay with us.
So as we shift gears into really thinking about the time of year we're at, one thing we wanted to make note of is that the holidays next week and beyond, bring about a lot of different dynamics, I guess you could say.
Yeah.
So Dr. Crowley is going to address this in our health talk next month. But we also have a couple great things to help kind of gear you up for fall, as well as kind of prepare you for some of the things that we know can often be a challenge during the holiday time. So one of those is last broadcast, you remember we had Dr. Rachel Goldman on, and she really walked us through how to manage stress around the holidays. And so if you did miss last month's broadcast, no worries. It's available on our YouTube channel, OAC TV channel, and it's a great resource for those great tips from Dr. Goldman, who's beloved among our community.
Absolutely. In addition to that, we have the OAC magazine, the Weight Matters magazine, our quarterly publication. This has a lot of valuable information in it, especially as we go into the holidays. In fact, we have a great article in here written by Sarah Montel, who just did a health talk, I think 2 months ago was Sarah's, which was very well attended. But she has a great article in here for fun fall recipes. It's on page 16 of the latest issue. So you should have this.
Is that in the library too?
Well, yeah. So it's not only is it in people's mailboxes by now, but it's also available in the OAC Resource Library. Click on Nutrition Strategies, and the article is going to come up. It's going to have all these great recipes for you to start your fall.
I know what recipes you're looking for as well.
Yeah, we'll talk about that.
For a sneak peek at that, our friend James here, he loves yams. Let's just be honest. Yams have been a staple in his household pretty much every week. Look at that. Look at you and your yams. So that's one thing.
Well, so in this, that might not be a to-spec recipe because I actually cover my yams with marshmallows.
Well,
and then I broil the top for a nice crisp.
I'm sure he'd appreciate your yam recipes in the chat. We really do give him such a hard time because we will proudly talk about What'd you have for dinner last night? And yams is part of the conversation more. And I don't know many people who eat yams beyond Thanksgiving, but we
Yams
won't
are very
belabor that.
nutritious. I can't speak to the marshmallow part, but
Right.
yams are very nutritious. And, we talked about what are we going to be thankful for? What are we
Yams.
grateful for? I guess I'm grateful for yams.
No, we've got some good sharings, though. I think let's shift to that a little bit. Of course, we have Michelle, who has shared some gratitude that she is thankful for her health and the health of her family. I could not agree more. That's important.
Yeah, Paula says, I'm thankful for those who continue to advocate for those with obesity. Paula, we very much appreciate that. I mean, I think that speaks to the larger OAC membership and everything that everybody is doing on a daily basis, to fight for this cause.
Yeah, and we also have Laura, who shares that she's grateful to be home with her family this year. I know that's certainly one for a lot of folks, and that she's incredibly grateful for this amazing community and conversations like today. So, Laura, you stole the words out of our mouths, because what we are grateful for is all of you viewers and those who support what we do all throughout the year and stay tuned with us. So we couldn't do this without you, and so we are so grateful for you all, and just sticking with us for our broadcast, which we love to do. We love connecting with our members.
Absolutely, and I just want to point out that Laura says, now I am craving yams.
There we
Me
go.
too, Laura, so I understand where
Laura,
you're coming from.
You know where to reach out to James for some solid recipes on that. But, so thinking about that, I do think that as part of gratitude, it's also the season of giving. And so obviously coming up right after the Thanksgiving holiday, after Cyber Monday, which is a big to-do, we have Giving Tuesday. So Giving Tuesday is on November the 30th. And as you know, that this is the National Day of Giving, where we all step back and really give to nonprofits that are really important to us and are important to our hearts. And so we have a special message from OAC's president and CEO to tell you a little bit about our efforts for Giving Tuesday this year. So let's take a quick look and hear from Joe.
Giving Tuesday is coming up on November 30th. Directly following Black Friday and Cyber Monday, Giving Tuesday is a day for people to give, collaborate, and celebrate generosity. Today we're extending an invitation for you to participate and get involved with the OAC on this very special day. There are many ways in which you can support our efforts and help us move our mission forward. You can make a donation, take action, share our message, educate others, and more. To learn more about how you can get involved and support the OAC, visit obesityaction.org/givingtuesday.
Excellent. So yes, so Joe, I appreciate he's kicking our effort off. So stay tuned to our channels for our Giving Tuesday. We really would appreciate and hope you can
Absolutely.
make OAC the charity of your choice come November 30th on Giving Tuesday. So we've talked about gratitude, we've talked about giving, which is really important. So now let's talk about health insurance, because this is the end of the year where health insurance, for a lot of folks, open enrollment is starting if you're on the Affordable Care Act. And folks are really evaluating their plans, looking into the new year to think, do I have the coverage and the right policy that works for me? So I'm excited. This topic is so timely for what's happening right now.
It really is, Christy. And there's really nobody better that we could possibly have to talk about this topic than Jamie Fivecoat. And she's going to walk us through what good health insurance looks like and how to pick a plan that's right for you. And we're happy to have Jamie with us here today. She's an emeritus board member of the OAC National Board of Directors and spent 28 years in pensions and benefits and was responsible for plan design and administration. There is no one better to talk about this topic than Jamie. Jamie, welcome to OAC TV.
There you are.
Thank you. It's good to be here.
And I think we also have to mention, Jamie was also the original chair of the organization back in 2005. You go back 16 years, even before James and I, you were part of some of this before. So I think it's long overdue you've been on our broadcast.
Yeah. Thank you.
Yes. Well, we're happy to unpack this. And I think, we really want folks at home who are going through this process of health insurance, but for even those who aren't, it's always good to help understand this more, because insurance is not easy. It's complex, right? So, we were hoping to kind of start there and let's, use your wisdom to help folks navigate when you are, in this process of looking at health insurance. What is it that broadly folks should be looking for, and how do they kind of navigate that whole process?
Well, you said that it is complex, but it's complex because there's so much choice out there. And so maybe we can narrow it down a little bit and try to take a little bit of that complexity out. I know that one of the things that we're wondering about, and y'all have been saying, what's a good plan look like? And really, a good plan looks like a plan that fits your needs, that does what you need it to do and allows you to pay for those services in the way that you want to pay for it. And I'll go into a little more detail about what that means. But the best thing, especially from the OAC perspective, a good plan is a plan that covers obesity, the treatment of obesity as a disease, and that treats it as completely as possible. There are some okay plans that will treat surgery, but maybe not anything else. But what we think of as a really good plan is a plan that covers the full range of treatment options for the treatment of obesity.
Now, Jamie, when we talk about plans, I think the tough part is that, as Christy said earlier when we started, you have the Affordable Care Act, you have employer-based plans. What are the different types of insurance plans that folks need to be aware of, especially this time of year when it comes to making some hard decisions?
So at a high level, there's basically a bug just flew through my face. I'm sorry. There are 4 types of plans that are out there, and of course, within each of those categories, there's a number of them. But for a lot of those, for people who are still working, there are employer plans, and there are those. There are individual plans where your employer either doesn't have health insurance, or you're self-employed and you've got to go out and find it. You have to go out and find it for yourself. The employer plans can either be self-insured or fully insured. And it makes a difference for you is that which ones those are. But in neither case will you actually have to make a whole lot of decisions wrapped up. They may offer, an employer may offer a couple of different plans, but basically what they're going to cover and the value of those plans are going to be pretty much equal to each other. There can be a difference in employer plans when it's a union contract is involved, because your union is going to negotiate for you what's going to be covered and how the payment structures are going to be. With individual plans, those are going to be fully insured, and the coverage can vary. And so that's something that you're going to need to want to look at. You mentioned, James, the Affordable Care Act, and the Affordable Care Act can come into play in that you can go out to exchanges on there that will help you pick what the best plan is, or there's a lot of brokers around that can help you find. And obviously you can go to individual insurance companies. And then there's Medicare. So for those of us in my age group, it's Medicare that's important to us. And for those people who are on disability, and if they've been on disability for more than 2 years, then you're going to be entitled to Medicare. And there's basic Medicare, which is hospitalization. That's A. It starts at age 65 for everybody if you're not on disability. There's Medicare Part B, which you elect to go into. But for all the other plans that are options out there, you have to have Medicare Part B in order to be able to do a lot of the other private plans that are around. And then the third basic plan under Medicare is Medicare Part D, which is the drug coverage. And that's a very important one for us, because that's one that we're really working hard on at the OAC to be sure that within Medicare Part D, that obesity drugs are going to be covered, when we really, really want it, and we advocate strongly for that. There's Medigap Plans, which are this alphabet soup of plans that are supplemental plans to Medicare. And then what they call Medicare C now, which are the Medicare Advantage plans that are out there on the marketplace, and they vary greatly. And so let me talk a little bit about, and then finally there's Medicaid, and Medicaid's for low-income folks, and if you're qualified for it, you'll know those. But let me talk a little bit about what breaks down. So what makes a plan, and what are the variables that can happen in there that you want to look for. First off is coverage. Coverage is, what are they going to pay for? And of course, it's under coverage that we are really looking for whether or not how they're going to pay for obesity treatment. And many times, and particularly in employer plans, you need to look at the exclusions, not necessarily the inclusions, when it comes to how they're going to treat obesity coverage. As an example, my former employer had an exclusion for any treatment, but they allowed for surgery because it was an exception to the exclusion. It didn't show up in the regular coverage part. So you have to know where to go look. And it's important that you look at not only what's included in your plan, but also what's excluded, and it'll give you some important pieces of information. Getting obesity coverage from your employer or from any other organization can be handled in a couple of different ways. I'm going to talk a little bit about that in a minute because it's another complex area of it. The other thing that's important, in addition to coverage, is how the pay structures work. And so you're looking at variables like copay, which means you're going to pay so much, like $25 each time you go to the doctor. You can have co-insurance. We all know about 80-20 plan. And you could have both of them. You could have a co-insurance structure for some pieces of your plan and co-pays for other pieces of your plan. You'll have premiums. And under Medicare, you can actually get plans with no premiums, and that are very good. But they'll be higher, maybe a little bit higher with copay, and a little bit, or the 80-20 structure will still stay there from the co-insurance standpoint. And then the other piece of it that's common in plans are deductibles, and where you have to pay out a certain amount of money out of pocket before everything else starts kicking in. And it's in that range of how these payment structures work that can determine how much you're going to pay for your insurance, regardless of which one of the four ways you get your insurance. And it is important to note that one of the ways it can kind of lower the price, but it still sits there, is what they call your out-of-pocket maximum. So you may have something with a little bit higher premium, but have a lower out-of-pocket maximum before they start paying 100% of everything. Then the other area that's important are your networks. What doctors that you go to are going to be covered. There's different types. What's what they call PPOs, preferred provider networks. There's HMOs. There's exclusive providers, and there's point of service. All those different types of plans. Your exclusive provider type of plans tend to be less expensive because you don't have a whole lot of choice. The next one would be a little bit less expensive are your PPOs. It's a preferred provider list. Your doctor may not be on that list, and that's what you need to check for. And the HMOs are also very restricted in who the providers are going to be. They've got to be parts of that HMO network.
So, Jamie,
it's important to talk. Oh, go ahead.
Yeah, no. I think you were unpacking so many really important key characteristics that are really helping folks try to figure out how they're going to really tackle. I mean, you talked about finding that, making sure you have the right coverage, talking about the right pay structure, and then, looking at the networks. I mean, that is really, really key. And so I didn't want to cut you off, but I think that for folks who are viewing at home, I think those are the three things that you're keen on: is coverage, pay structure, and making sure you have the providers in your networks that you need, right?
Absolutely. And so the best way to make sure your provider's in there is to talk to your provider.
Yeah.
Ask them what networks they're in, and most of them are going to be in multiple networks. And it's also important to note that the best networks are normally going to be provided by national insurance companies. Those that, such as United Healthcare, that works with the AARP, or your Blue Cross Blue Shield organizations, or Cigna or Aetna, the big providers, and the ones that we can a lot of times get very upset with because we may not have always had really great experiences with it. But remember, all of them are going to have issues when it comes to denials and how things are covered. So it's important. There are three things to really ask: who is the doctor in my network? What's the cost structuring? But the other great thing that is what drugs are covered in the plan. Well, and how are drugs covered?
Yeah, so we have a couple reflections about this I wanted to share as you were talking, because I think you're sparking a lot of great conversation online. And Deb, I think it's probably Deb Gao who says hello, but Deb is saying that she's really excited for this conversation, and she's enforcing that having obesity coverage is important. And so to please remind representatives to support the Treat and Reduce Obesity Act. I know we're going to get to the advocacy part in just a second, but I think what you're talking about with the drug coverage that you're talking about, that's what's so key when it comes to looking at your insurance.
It is, because most plans in that exclusion area specifically exclude coverage for drugs. Yeah. And so that's something that we can all fight for. And it's definitely something. So what is, each plan has what's called a drug formulary. each plan that covers drugs has. So that's the other thing you got to be sure of, that your plan does cover the drugs, and so you list your drug when you list your drugs, and you find out, would compare it to all the different plans and how they cover the drugs you're currently taking, and so that's the drug formulary that goes along with that.
So Jamie, I think there's so much that we're unpacking here. And in fact, the people in the chat are saying, I'm just starting Medicare in January, got to get my plan picked out, so many choices. Laura says this is priceless information, the best way to be proactive and understand your plan. But as you know, as a longtime OAC member, when it comes to obesity coverage, that's often not that great, and it's pretty scarce. So what do we tell people who are looking at their plan? They don't see medications covered. They don't see behavioral therapy covered. They don't see bariatric surgery covered. What are some tools that we think we should tell people to say, hey, this is how we can start to change things?
Okay, so there's a couple of different approaches to it. If you haven't tried to utilize any services yet and already have a bill for it, then the best thing to do is to go to if it's an employer covered plan, is to go to your employer and say, we really need to have obesity coverage, and this is what a good obesity coverage should look like. And they can ask for our help to help them do that. But if they've already gone out and they've already started talking about getting, gone to one of our specialists that we have listed in our providers list, and they want to get a prescription, and then realize if things aren't covered, it's being rejected, they can file an appeal. And through the appeal process, even though the plan specifically says it's not covered, they can still file an appeal requesting that get overturned, and that particular aspect of the plan be changed.
Yeah, and I think folks don't realize that, right? They don't realize that simple process, just because there's an exclusion there, that doesn't mean it stops there, right? That's a lot of what we advocate for. And in fact, the original insurance guide you pointed out, James, on in our library, that you helped Jamie build back in the day, that needs a refresh because this information constantly changes. But it has sample appeal letters to appeal exclusions, to demand otherwise. And I think that's a huge message here, is that, a lot of times we don't realize how much influence you can have by simply raising your voice and demanding better.
Exactly. The company that I worked for didn't cover it in the 80s and the 90s. And then in the 90s, a group of employees went and appealed and went to at that point in time, we had a physician that was in charge of medical stuff, and we finally got it. We finally realized that we needed to make a change. But the only thing they started to cover was bariatric surgery. They still didn't cover the drugs, and that still was something that even after I retired was still in the works of being done. And like Deb said, the TROA is really important with that.
Oh, yeah.
And Jamie, I think you're bringing up so many valid points here, but I think it shows that step that you all took at a certain point, it did create change, right? And I think that's where you have to start somewhere. And I think our folks in the chat are even saying that. And Shelley says she's thankful for OAC fighting for all obesity treatments to be available to those that choose to seek them. So. I think, Christy, I think it's safe to say that we probably could spend the next 3 hours, 5 hours talking about this topic. But, it probably, maybe a future health talk.
I'm still in a future health talk, and I think we can rope Jamie into doing that for us.
I think so.
With all your spare time,
right? Glad to. Oh, hey, I'm retired. I get to do everything I want to do.
That's right. So, you're busier retired than you were working. I've always told you that, yes. No, I agree. I think this, actually, we're actually getting some acknowledgments just from this broadcast that Laura was sharing. She didn't know you could appeal scripts, right? Like, this is really priceless. Oh, yeah. It is priceless information. So I think it does help us kind of prepare for those next steps and how we really get folks to start fighting back, like OAC does.
Yeah. So what's important is to her point is that if you call the insurance company will say, yeah, you can appeal it, but here's the process.
Right.
But if it's an employer, particularly a self-insured employer's plan, the insurance company's not the final word. The employer has to have an appeals process that is the final word. And that's key for employer plans. But for individual plans, you can always appeal it, and it may not get not as far, but at least they have that in their records of appeals. And if you just keep appealing and appealing and appealing, it stacks up, and they begin to realize they've got to start really making some change.
Such important advice, absolutely. Jamie, I am so sad that we are out of time for this. I know we come to the end of these broadcasts so quickly, but if you could leave folks watching from home, I know there's a lot of information here, but if you could leave them with just a couple things, as they navigate this end of the year process and, kind of moving forward, what would you say to the folks viewing at home about insurance and where to go next?
Yeah, so if you have the opportunity, or if this is a time frame for you to look at your insurance coverage, take the time to be sure that the coverage that you have right now is suiting your needs, and then go to, I would recommend going to an exchange, because there you will get a professional broker who will help you navigate through. They're free, and or there'll be a background system, or you can just plug in the answer to the 3 questions that we mentioned: who your doctors are, how many times you've been going to how frequently you use the services, and what drugs do you take. When you go to those exchanges, you answer those questions, they will tell you what the best plan is for you that's on the market.
Excellent. And a great reminder too to keep raising our voices for this.
Absolutely.
We're continuing in this effort, and so we appreciate your leadership in this realm for us, Jamie. So good to see you on OAC TV. Thanks so much. We'll see you again, I know, pretty soon. Actually, tonight on a membership call, I'll see you.
I may be a little late. There's a transgender remembrance service that I'm going to tonight before that meeting starts. So
good reminder.
Be on phone.
Good to see you.
Okay,
Thanks,
thank you.
Jamie. Take care.
Bye.
Always so much happening here, right? The OAC.
Well,
we're so fortunate to
and
have.
You could see all the chatter in the chat, and I think that's that's why we picked this topic for November. Just it's a timely topic, but how confusing health insurance can be. It's intimidating.
Yeah.
And I think somebody like Jamie comes in and really helps distill it so that everyone can understand it, right? But what, again, and a very interesting part is once you understand it and then you understand what the limitations are for people with obesity, that's where OAC comes in.
Yeah.
And that's 100%. That's why we exist, to do what we do. So thank you very much, Jamie.
That.
And with that,
it's time.
It's giveaway time. So Christy, who's our first winner?
So it looks like our first winner is someone whose birthday is today. Linda Halpin, happy birthday. And you are the lucky winner of one of our mugs. So we will connect with you and get your information so we can send this to you. Happy birthday. It's a great birthday treat for you.
Our second winner is, let me see here, Nancy Nichols. So Nancy, congratulations. I'm not sure where you live, but if it's going to be cold anytime soon, this is perfect for a hot beverage. So that will be coming your way. And we want to say stay tuned with the OAC. Follow us on social media next week, the week after next with Thanksgiving and Giving Tuesday is going to be huge. Definitely a time for you to help support OAC and get more involved in what we do. Join us on December 16th for our next health talk at 7 p.m. Eastern with Nina Crowley. We'll be talking about how to enjoy the holidays and stay on track. One day before that, December 15th, please join us again, same time, same place for the OAC TV broadcast. And now is the time that we've been waiting for. We are so excited to welcome a very special guest to debut one of the brand new Stop Weight Bias merchandise fall line limited edition, November 30th, final day to get it. We have our special guest with us here today.
Here are our brand ambassadors, our very own Maddie Manley, who works on OAC staff, but we have Zero Joaquin is his official name. He belongs to one of our other staff members, but Zero is modeling our fall line doggy t-shirts. Yes, doggy t-shirts, small, medium, and large. You can only get them till November the 30th in the fall designs, but we're so happy. He's been such a good model for us, and he's really proud to be wearing and sporting this important
Zero's
message.
wearing a small, but he's showing off his muscles a little bit.
Yeah, if you want to get snow, but no, we are hopeful that you guys can go on and shop on our Weight Bias store. Happy to have Zero and Maddie. Thanks, Maddie, for taking part in this. But good reminder, our next broadcast will be next month. Special holiday episode. Maybe we'll be into holiday sweaters again. We haven't decided on attire, but that's coming up on December the 15th, same time. Mark your calendars. But thank you guys so much. We wish you all a very wonderful holiday coming up. And please stay tuned to all the things. Lots is happening, safe to say. But we will see you next broadcast, and thanks for tuning in.
Thank you very much.
Bye,
Have
guys.
a good Thanksgiving. Thank you.
Say bye, Zero.
Bye.